Hi everyone, this is Dr. Shakti. I'm back once again, and this time we are going to talk about a few of the things that really bothers our senior citizen on daily life. Many of us have seen that the weight is something which actually contributes a lot in creating problem in your daily activities. Like it's not about your like if you are in your 20s or 30s, even at the age of 60 or 70 as well, mostly females, they have this difficulty while walking, climbing, or coming down on the stairs. And it's not about like the joint pain or arthritis, it's also about the weight that is contributing. Right now, at that time or that phase, we cannot prescribe the client to go for some kind of exercises or high intensity workout, because of course of the aging process, and definitely there are few other conditions which are going to limit the activity process. So at that particular time, at the age of 60 or 65, when you are going to take advice from a specialized physiotherapist, definitely who is in a geriatric case, or someone who is trying to help you to overcome those challenges, remember that consistently trying few of the exercises at home and under the guidance of a physio is very important. Why? Because you might face these challenges while sitting, while lying down, while doing some activity, and henceforth the pain increases and your range of motion decreases and you stop doing your daily activities independently, right? So our aim is to create mobility at this age, and also to make our client more mobile and independent while doing their activities of daily living, their ADL course. So what we can do is create a protocol, right, for your client who is above 60, who is consistently doing an activity which is task specific, right? So you cannot tell a person, if a person is having pain because of the weight, knee pain or joint pain or hip pain, you need to maintain mobility along with rest interval, right? And the person is doing it activity on daily basis with some task related challenges. Like you can give some mirror therapy where the client is able to see their body part moving on the good side, and the other hand he tries to do it on a practical basis. And next is about trying some very low intensity activity. Weight bearing is advisable but under supervision. So when you start with low intensity activity, you need to give some time. It's not about week, after the week is over, on the second week you are going to start with moderate intensity. No, it's always a client centered approach, right? I've always been talking about this in my previous videos as well. So when you are creating a protocol, it should be client based, client centered approach. And that means whenever you see the progress in the client, then only you should jump from one intensity to the other, right? So higher intensity low repetition, or higher repetition low intensity, that you have to decide how the client is able to perform the activities. That may be your TheraBand activities, that may be active movements, there may be a little bit help, you can do some gym ball activities. So these exercises, when they can be modified, right, moving your joints in particular angle in which your client feels comfortable, that is important. Remember to educate your client about the duration. It's not like you do it for a month, the person becomes very well and he will start walking in the park and go out and do his activity. If you're able to educate your client about the long-term effect of physiotherapy, the exercise, the movement analysis that you're doing, then of course the client will have the trust, and the client will also be confident on the technique that you're following. So consistently trying it out at least for a month or two, or for your lifetime. Movement is always important. Along with that, you need rest. Along with that, you need proper lifestyle modification, because at the age of 60 or 60 plus, you need to be mentally calm as well. So including some kind of breathing exercises, some kind of healing process like listening to your favorite slow music, which is going to heal them from within, right? So being a wellness expert and a physio, it is really important to combine all these things together and then come to a conclusion and create a protocol for your client. Before you create any kind of protocol, chat with your client, discuss with your client, and educate them about each and every step that you're creating for them.